Hi, everyone, and thank you so much for joining us today for our webcast, What's Giving You the Blues. This is an executive-driven discussion on cost containment for operations. Today we'll be discussing how you can contain costs in appeals and grievances, customer service, enrollment, pending claims, and prior authorization. And with that, I want to flip it over to Maureen O'Neill.
Greetings, everyone, and welcome again to our session today, What's Giving You the Blues. A little bit about my background. Here at IBM, I'm a healthcare industry solutions executive, have been doing this for over 3 years now. Prior to IBM, I was a Gartner research analyst for healthcare, and prior to Gartner, I worked 20 years within the Blue Cross Blue Shield family, spanning roles from IT analyst to my last role of VP of Corporate Communications. I'd like to speak to you a little bit today about some of the challenges we're all seeing in this industry. Think for a minute about instant gratification. That's the norm today, even in insurance. Whether delighting a customer in real time, reaching new markets, or collaborating with partners and suppliers, in the blink of an eye, insurers must exceed expectation to achieve a competitive edge. And it's not just about speed. It's also about the experience. Every interaction is a moment of truth, and moments matter. By fusing intelligence and context into all your health plan processes, you can become essential to your customers, partners, and suppliers. Doing so requires an integrated approach fueled by the power of automation, optimization, and collaboration. The healthcare industry is no doubt rapidly evolving with many challenges: regulatory, economic, consumers, social media, etc. Business as usual is not an option. As you see here on my first chart, you'll see that there are some notable trends or drivers that are hitting the industry. First is public and private cost pressures. Facing unprecedented government, employer, and consumer budget constraints, health insurers understand that healthcare cost trends are not sustainable. Then there's healthcare policy and reform. As you all well know, the Affordable Care Act in the U.S. is driving increased focus on efficacy and outcomes in all markets, as well as a movement to modernize healthcare infrastructure. New waves of healthcare consumers. The push to more personal accountability creates empowered individuals who are demanding choice, value, service, and quality. The demographics is shifting, and the supply and demand ratio is changing. We have an aging population, increased incidence of chronic disease, and physician capacity shortages, all driving healthcare to look for alternative delivery models. Innovation in technology, growth in specialty and biologics are creating significant scientific and financial hurdles for game-changing innovation. And maturing product innovation and changing spend. As deeper life science insights around root causes emerge and therapy effectiveness is closely monitored, health plans, like all of you, need to retool health insurance products to meet this new demand. These 6 drivers result in several overarching healthcare megatrends, which we'll see on the next slide. First is renewed focus on cost, evidenced by narrowed physician networks and more cost shifting to the employees. Integrated care delivery models, decrease of independent doctors, and adoption of evidence-based guidelines to standardize care. New payment models are being seen, whether it's patient-centered medical home, accountable care organizations, or other risk-bearing partnerships. The payment game is definitely changing. Shifting care to lower-cost sites. Utilizing non-traditional caregiver sites often offer alternatives to lower costs and reduce the impact of physician shortages. An increase in consumer power and engagement, creating a greater role in decision-making for consumers and demand for transparencies in all aspects of their interaction with their health plan. and, of course, as we've known for several years, a focus on wellness and prevention. If we look at the next slide, we see an illustration of a logical progression of capabilities that look fairly traditional, things that you and I have seen for the last 5, 10, even 20 years. And yet, as we start to look under the hood at how the drivers and changes are changing the game, you see process and people being asked to do more, faster, and at a lower cost. Whether this need drives from more consumers directly purchasing health plans, generating new, unproven processes that drive increased levels of customer service and support to help them through these processes, or new eligibility guidelines in enrollment and billing processes that are expected to be completed with simplicity and speed of a credit card transaction, or the unprecedented demand for greater transparency, immediacy, and coordination of care management, claims processing, complaints, grievances, and appeals. And then also to the member satisfaction, which has always been important, but now has evolved to a more stratified, scrutinized metric. This system, our system, is really under stress. And if we look at the common patterns that we see behind all of this, as we, IBM, and our business partner, IPD, as we scan the environment, we look across the health plan ecosystem, and we find underpinning these various capabilities, we see a reoccurring pattern for the need for automation, workforce automation, optimization, increased and diversified information management, along with collaboration and the management and work in process across the enterprise in order to ensure that people, systems, and information are enabling best results. My partner, Jeff, would like to talk to you about how we can help you with some of these reoccurring patterns. Jeff?
Yeah, hi. Thank you very much, Maureen. Good afternoon, everybody. This is Jeff Gerlach from IPD. So IPD is an IBM business partner. We've been building and implementing solutions for healthcare payers for about 23 years. And I've been with IPD for a little bit over half that time. And essentially, my responsibilities are for the product development and product strategy, and so very much involved inside the healthcare payer marketplace with helping construct solutions, build solutions, but also helping look forward at what trends that we're seeing out there in the industry and taking a look at some of the technologies, solutions, and platforms that we've been putting in place to help address those and help keep the healthcare payers as competitive as possible. So kind of getting into the theme of today's webinar, we had sent out a poll a while ago to the respondents of this webinar asking what's most important to you, what are things that you wanted to hear about, and loud and clear, cost containment came back as the number one thing that folks wanted to hear about. And so what we tried to do was pull together some good examples or some common denominators of cost containment across some of the big operations inside of a healthcare payer. And that's kind of what we want to dig into here is let's look at some of those key patterns and what you can do to address that when it relates to cost containment. And so obviously we can talk about systems and technologies and tools and best practices, but at the end of the day, you have to be able to deliver results to the business, better improvements to your members. So there's a lot of different areas here, but the whole theory here is that at the end of the day, we have to be able to deliver results to the business. We're not just implementing these systems for the heck of it. And when you look at the different areas that we're going to focus on today, you've got all sorts of different places that you can look at, but from a worker productivity perspective, being able to have a very efficient workforce is key because we know how high labor costs are and they're not going any lower as we look into the future. Adaptability, things like the Affordable Care Act, organizations need to be agile. They need to be able to quickly adapt to new and changing regulations We know that there'll be more changes coming forth, and you need to be able to adapt those into your business quickly and run with them. So talk a little bit about efficiency. Member touch point measurements. We all know how important that those are and those scores, and being able to keep our members happy with the products that they're purchasing. As Maureen mentioned, as we get to more of a personal accountability market for healthcare, people are having more interactions with their healthcare payers than they were in the past. And then you get the bottom line profitability. At the end of the day, if we're able to pay claims faster, more efficiently, root out fraud, keep our renewal rates high, all that contributes to the bottom line. So when we take a look at the underlying system here, one of the things that we've been working with and have implemented and seen is the IBM Case Manager platform. It's quite a broad platform, and it's quite unique with the capabilities that it does deliver. We're not going to get into the granular level details here, but just know that we do have an enterprise-wide platform here capable of delivering all the foundations that you need in this type of a solution. So when you take a look across here, being able to deliver solutions out to your mobile users, being able to deliver work-at-home users, having real-time dashboards so you can see all your inventory, being able to have analytics so that you see what's going on with all your work inventory. All these are capabilities that are on the system. And so, like I mentioned, we're not going to dig down into the details of each one of these, but what I would like to do here today is give you an example or two of how we've used these tools and technologies to address this cost containment across multiple areas. And so if we start to take a look, how do we take a solution, how do we take a platform like this and really apply it to have tangible benefits to the business? So let's kind of start with teeing up the business problem a little bit. And so what we're trying to show here is you have your knowledge worker in the center. This could be someone that's working on claims, someone that's working on enrollment, someone that's working on appeals and grievances, someone that's working in customer service. But this is a common pattern that we see across many healthcare payer organizations, where you have the knowledge workers sitting in the middle there, and they're forced to interact with 2, 3, 4, 5, 6 different systems to be able to do their job, to be able to process a claim, or to be able to resolve an appeal. And so this is a very common pattern. I think that the maximum number of systems I've seen is about a dozen that one person had to reach out to be able to pull in information, to be able to make a decision on an appeal or on a claim. And so when you take a look at this picture, and you know that this exists across all those different functional areas that Maureen had talked about, that's part of the crux of the problem that we have here. And so for each one of these areas, if we have a unique set of systems, it's very difficult to onboard new employees. It's very difficult to have consistent decisions across the enterprise because there's different ways that people pull information out of all these systems. Understanding all your inventory and work in process can be very difficult because there are so many systems involved. And then governance across the whole process and compliance can be very difficult as well. Whenever you have auditors coming in from outside entities to take a look at it, it can be very difficult to explain, can be very difficult to reconcile across this type of environment. So if we kind of remember this one, here is essentially the macro pattern that we're looking at. And so in working with some of our healthcare payer customers, we've done studies to try and determine where are folks really spending their time. And so when you take a look at these knowledge workers, essentially they're spending approximately 20% of their time focusing on the high value-add activities. This is where they're using their knowledge to make decisions, once again, whether it's about claims or enrollment, customer service, appeals. But the point is 80% of their time are doing moderate or what we call low value-add tasks, things like walking over to the fax machine and getting a fax, or going to centralized inboxes or printers to be able to get information and bring it back and make their decision, looking into other systems to grab data, cutting and pasting data between systems. And so when you think about that, in terms of the value that you're getting from your workforce, it's very suboptimal. And so kind of looking at the before and after picture in terms of implementing systems for some of the capabilities that we're going to talk about, when you take a look at the productivity effect that we have for our users here, it's absolutely phenomenal. And so not just focusing on the user productivity, but some of the other things that we talked about, the agility, the efficiency, having better customer service interactions with your members, all those things really add up when you're implementing, when you're working with these types of systems. And so let's kind of drill down and take a look at that in detail. So when you look at the common factors across all these different areas that you have these opportunities to contain cost, that's kind of what we put out on this slide here. So automation, being able to automate low-value add tasks, so you don't even have to have human beings take a look at it. I'm sure most folks here are familiar with things like business rules engines or workflow engines. So there's a lot of tools out there where you can automate these low-value tasks. And so not only do you not have to have users involved with it, the accuracy of your decisions is absolutely improved upon. So now for the tasks that we can't automate, being able to optimize this workforce and be able to get the right work into the inbox of the right user. Skills-based assignment. That's absolutely critical and important because not all users are cut out to work on the same type of work. So using roles, using different tools and technologies that we have available to us, just being able to manage those inboxes based on skills, or if you need to be able to move work from one side of the house to the other, you have all those abilities as well. But that's where you can really manage and be effective on these systems. Optimize the information through unified work views. Being able to bring that information together so your user can look at one system and not 2, 3, 4, or 5 systems to be able to render a decision. Not only does that make their job easier, but in terms of the quality of your decisions, the timeliness of your decisions, and the consistency of your decisions is going to go up as well. Organizational collaboration. Collaboration gets thrown around in a lot of different contexts these days, but the idea here is that once we have this system like this in place, multiple people in the organization can easily take a look at this. They can be assigned different tasks. Being able to assign lower value-added tasks to administrative folks, higher value-add tasks to caseworkers. It's the ability for more folks in the organization to be able to participate down here. Things like clinical review or medical review, being able to easily fork those off for other people to take a look and collaborate on it makes for very good results. And then what good is all this unless we can see everything that's going on? And so being able to manage this work in process, having real-time visibility to all your inventory. Show me all my inventory by due date. Show me all my inventory by dollar amount. Show me all my inventory by provider ID. When we have all this information together, being able to ask those questions, you have results on your fingertips in seconds. You don't have to wait till tomorrow's news to be printed. I mean, if we had to wait till, everyone gets their news now real time. They don't wait till the paper shows up tomorrow morning. They want to see it now. And that's essentially what we're able to do here. So not only do you have real-time visibility, you have analytics and you have reporting, so you can see what happened last week, what happened last month, and tell me what I need to be on the lookout for next month. So when you have all those in combination working under here, these are great examples of how we can start containing costs inside of an organization. So let's jump into and show you just a couple examples here of what we're talking about. So I've got a solution overview here. This is something that we've kind of genericized and put together having dealt with other customers in the healthcare payer organization. So let's just take a pretty simple example here. So we have some type of incoming document, and whether that's a fax, whether that's an email, whether that's a letter, whether that's an e-form, whether that's a telephone call, but essentially we have multiple input channels that come in through any organization. We go ahead and run that through a rules engine to be able to evaluate what do we do with it. As everybody knows, duplicates can be a real pain, and so just simple things like determining if a case or a claim or an appeal already exists, let's marry them up to work in process versus creating a new one. So these are great things. These are things that systems are great at doing without having to involve human beings, and they're very accurate doing it. And so in this particular example, once we get some type of new input, we determine that a case does not exist, but we know what type of case it is. We know it's an appeal, or we know it's a claim, and we can go ahead and create that case structure. There's also a full set of workflow capabilities on the system, and I think for any organization like this, it's absolutely key to have the workflow systems in place. Unfortunately, most organizations have multiple workflow systems, but in terms of the real cost containment, being able to have one workflow system that can work across multiple organizations is really key. So once the case comes in, we can go ahead and launch the workflows or launch the tasks, be able to go ahead and route those tasks based on skills. So we know that a medical review person is the right person to take a look at something like this, or this is a high-dollar claim, it needs to go to a senior worker, or this is something for congestive heart failure, it needs to go to some other type of specialist. All those are rules that can be programmed into the system, or I should say configured into the system, so that all that can take place even before a human being ever has to look at this or spend time on it. Other things, because we have a complete document management system in the background here, we're able to file the documents with the case. So now, once the case is created, we're able to attach these documents that will follow the case all the way around until that case is archived sometime way down the road in the future. In addition, all the case history and everything is associated with it, so we can see who touched it, who did what to it, when did it happen. So in terms of having accountability, not only internally, but from an audit perspective, it's absolutely imperative. And so as we continue to build down this slide here, being able to route tasks to specialty workers like a medical review, and then being able to place this case on hold, let's put it on hold, and nobody should be touching it until we get some additional medical records or information that comes in on this particular case. And so now, once again, I kind of genericize this, but this very similar pattern can be applied to a lot of different areas inside the healthcare organization or the healthcare payer organization that really lines up with some of the topics that we just talked about. The automation, the skill-based routing, the visibility, and being able to have all this under centralized management. And so now, this slide here essentially sets up our case, and let's go ahead and take a quick look. From an end-user perspective, here's what you want to happen. This is a pretty simplistic view. Down the left-hand side, we're seeing a list of inboxes that a user can work in, and you just want to make this as simple as you can for your users. Your users log in, they click on an inbox, and guess what? All their work for the day is sitting there prioritized, waiting for them to start. They don't have to go to the printer. Nope, we don't have to wait for spreadsheets to be handed out. We don't have to wait for spreadsheets to be emailed out. They log in, all the work is pre-populated, and these work queues will fluctuate during the day. So as new work comes in, it'll go through all that analysis beforehand and essentially land into users' inboxes, and this is essentially their integrated environment that they're going to be working in all day. All the user has to do is go ahead and click one of these and open it up, or if you even want to simplify it further, well, you just put a start button out there for the user, and you're really getting into some efficiency now. So the user just logs in, hits the start button, and the system's going to figure out what's the most important work for them. So once again, just kind of the tip of the iceberg here on the whole skills-based assignment and whatnot. So once you're inside of a case itself, and remember, this case can represent a claim, an appeal, an enrollment, customer service. There's a lot of different things it can represent. This particular example is representing a member appeal. And so once I've opened up this case, I've got a lot of information and a lot of details about it. We have requirements listed on here. We have percentage complete. You have due dates. But the idea is that you give the user a very centralized view into everything that's going on. There's some natural integration points on here as well, so that you're pulling in information from adjacent systems that coincides with the appeal number or the member number or the claim number that I'm working on, but this is going to guide your user through the steps that they need to go through. So from a consistency perspective, from an inventory perspective, and from a quality of decision perspective, that's what can be managed through a centralized user interface. In the middle of the screen there, you see we have decision checklists, so we can go through reflexive questioning to help guide these users to final decisions. And once again, these can change based on the actual use case, but I think this is a really good example, just walking your end users through a decision tree to be able to come to the right outcome for this particular appeal. Once again, going back to the consistency of the decisions, being able to drive the consistent decisions based on the rules that you've configured for your system is very, very important. Kind of moving on to the next screen here, talking about collaboration. This is a particular one, and all this is examples from a current system. This is someone for a medical or clinical review would be working on. So once again, this is a little slightly different view into the same case, but what we're allowing is other roles to participate on here. So this medical review person, whether they're internal to our organization or external to our organization, they're shown the information that they need to see. Once again, they're not seeing all the attributes of this particular case. They're seeing the attributes that are relevant to them. Once again, we have a checklist in the middle there. We can go through the reflexive questioning. So based on what's happening for this particular case, we're going to flash a set of questions, and then we're going to be able to go ahead and take notes at the bottom there so we can document what's happening. So once again, going back to the consistency in driving consistent case outcomes with a set of rules, and then enabling collaboration so that more folks inside the organization can participate. This is a pretty simple example here. We have plenty of other examples where things like administrative work, checking on additional information, but this just gives you a pretty simple example of how other roles in the organization can contribute to the outcome of this particular case. And so kind of moving on here, just giving you a little bit of insight here, having visibility into what the heck is going on is very, very important. As I mentioned before, no one wants to see today's news on tomorrow's newspaper print edition when it comes out. We want to see it right now. And that's essentially what we're looking at here is everyone loves to see how efficient their users are, right? Who's doing what, how many did they do? These are snapshots that are taken all throughout the day, processed through a data cube. And essentially what we're able to do is show you for each one of the work queues that your users are working in, how many have they processed, how long have they taken to process them, and we can slice and dice the data based on, show me the number of days, the number of minutes, number of hours, number of work items that they completed. It's just very, very helpful to be able to have this information as you're going throughout the day. And what's even more amazing is once your users can see this information is being tracked, the level of productivity can be a real enhancement as well. And so just taking a look at the next one that's on here. So obviously we don't want to put the users under the spotlight all the time. You need to be able to take a look at the overall system here. So looking at the number of cases, here's the number of cases that the new ones that came in, here's the number of cases that are in process, and here's the number of cases that were completed for the particular time period that we're on here. And so for all the different entities that we have inside of the system, whether it's rules, whether it's cases, whether it's workflows, whether it's users, whether it's work items, we have the ability to track this all the way through. So at the end of the day, you can see what your inventory is here. Let's say this is a pretty good example of the number of cases. And so you can see, but based on the number of cases that you have coming in versus the cases that you're closing each day, it may not be a problem today, but it may be a problem 3 days down the road or 4 days down the road, or if you have a spike later in this week, you're not going to be able to handle that spike. So that's going to start to give you visibility into the trends and help you understand a lot about what's going on inside of your current inventory. And so just kind of summarizing here some of the things that we talked about in terms of containing costs. We think that these are patterns that can be applied to all the different areas that we talked about in terms of, the claims, the appeals, the customer service, the enrollment. And essentially what we tried to do is factor out the common denominators that we see as being absolutely essential across these areas. That's not to say that there are unique nuances about each one of those environments where you can really ratchet it down and zero in and do a better job to contain costs more narrowly. But essentially what we tried to do is take a look at the common denominators, and that's what we've got summed up here. So just summarizing, having that visibility into the entire inventory, the ability to manage by service level agreements or by customers. If you have high dollar or VIP customers or VIP sections within customers, if you have the ability to see that, route and prioritize work based on that, and view reports based on that, you can really increase your customer satisfaction by having that data available to you. It's again eliminating and automating the low-value tasks. Having the capabilities of a full rules engine is absolutely wonderful inside of this environment. As I mentioned, not only can you eliminate those, there's a lot of tasks that you can take away from users and really allow them to focus on higher value areas inside of the organization. Case collaboration, as I mentioned before, collaboration is a word that's used quite ambiguously throughout the industry today, but being able to have multiple people look at this case all at the same time. We've all seen scenarios where we have the manila folder running around the organization, and case collaboration is when I hand it from me to my colleague, right? And so being able to not only have other users work on it, but be able to have users work on it in parallel so that you're better and more effectively managing your service level agreements is key. Consistent processing capabilities. We've all seen these haphazard environments where you put a decision, you give the same set of variables to two different users or two different departments, and you come out with different answers. And I don't think that any management team likes to see that happen. And so being able to provide consistent answers, not only amongst your team, but your members, you're getting the same answers consistently out of the organization. I think that's very important and goes right back to the whole customer satisfaction as people are becoming more personally accountable for their health care. We see that these types of interactions are becoming very, very important, which plays right into the next one here, is just enhancing the whole member experience. Being able to, when customers call in or members call in, where's my appeal, where's my claim, what's holding this up, being able to have that 360-degree view of not only the work in process, but all the history that's associated with this member, so you can see the last time they called, last time we had an interaction, see the claims that they have in process, see the appeals they have in process. Very, very, very valuable. And so the last thing on there is just, reducing the cycle times. Anytime we can reduce the cycle time, whether it's, on enrollments, being able to get that information back to the user, whether it's an appeal, being able to get a decision rendered to the user. We see a lot with the individual health care plans where there's a lot of prior authorizations that need to take place, expedited authorizations that need to take place. This is a great platform to be able to turn that around and create a wonderful experience for your customers. And so just kind of, whoops, wrong button there. Let me move forward. So where do I start? So the first bullet point there is the whole boil the ocean parable. I mean, everybody's heard it. But what we see is people trying to bite off more than they can chew. And so we're talking about a lot of global patterns here across an organization. What you've got to do is find a use case that fits very nicely, and that's always the way to get started on here, is you want to look at these across the organization, but find something that's going to get some great use cases where you can start to get some traction. Because really where you're going to really get the ROI out of these things is if you have consistent tooling and consistent technology that can be replicated across multiple organizations inside a healthcare payer, that's when you're really going to get the ROI. So you don't have to have one set of tools for your claims world, another set of tools for your appeals world, and another set of tools for your own world. If you can have this set of tools, that's where it's really going to take, pardon me, that's where it's really going to be advantageous to take advantage. The whole iterative approach, this is something that we can't harp on enough. The waterfall methodologies, they all work great in certain instances, but in this day and age, when you have software that you can do modeling with, you can model user requirements literally within days through the use of configuration. Users are great at when they see something, they can tell you if they like it or they don't like it, but it's very difficult for them to take a blank sheet of paper and write down from scratch what they want to see. Using an iterative approach, being able to reflect that information back to users within days is an extraordinary way to be able to do some rapid prototyping. On the flip side, we all know users have quite an insatiable appetite to be able to ask for things. And so managing scope, keeping it small, and getting some quick victories on here are absolutely key. And that's what I'm saying, find patterns that fit. No one wants to go out and write custom code to do any of this. And we all know the risk and cost and time frame that just totally, in the speed to market. If you can find patterns that fit, and trust me, it's a very comprehensive system and things that we're talking about, you have a lot of great opportunity to find patterns that you can iterate very quickly and without having to do through the use of configuration only. They're going to work great. We all know the business sponsor aspect as well. No one wants to be on their own limb doing something like this. And if you can show quick victories, be able to iterate with users, get users excited, that's when business sponsors really want to take a vested interest in something like this. No business executive wants to take a vested interest in something that's not tangible to them and they can't see results. So when you can do these things above, being able to show quick results, you'll find that business sponsors are a lot more keen to sign up. And so the last one there, paint the big picture, grow the footprint. That's what I was hitting on first of all in terms of we see these common denominators across so many different organizations inside the healthcare payer. It's having that big picture to say, look, we can use common tooling across all these areas. Here's the common denominators. Let's start small, and then for 2014, here's what we're doing. For 2015, we're going to increase the size. In 2016, here we go. That's how these systems really start working, but that's when the organizations really get the ROI from these types of systems by being able to roll them out, using the same tooling quickly, having the agility to do it, and then being successful at doing it.